that's good because I want to pick my nose.
Now we're live. Hi, everybody, and welcome to, gosh, it's already May and mid to end of May. So this is our May live pet real mushrooms Q&A. Probably said that backwards, but I think everybody gets the point. It's great to be here, and it's great to see you, Dr. Silver. Last month I took the month off, and you and Lee had a good time chatting about ergotheanine. Tonight we're going to be talking about a topic that, according to our wonderful Britta behind the scenes, she said we've gotten quite a lot of questions on this, and that's basically lumps and bumps on your pet, and how to determine like when it's time to get them checked out, etc. So, gosh, and my little old Scruffy, my 14-year-old Scruffy, she's got some lumps and bumps. So I'm very curious to hear your input on this. So, lumps and bumps and mushrooms. What say you, Dr. Silver?
Well, first I'm going to say a little disclaimer here. Or should we wait until I'm done with this first part? But the disclaimer is just that I'm really glad that everybody's here, and I really want to do my best to answer all of your questions. But because I don't really know your animal, I'm going to do my best and be giving you what we would consider to be educational information. I can't really be giving you medical advice because I'm not there with your pet. Okay, but I'll do my best. Okay, so lumps and bumps, probably one of the most common reasons in veterinary medicine that I have patients come in for examinations. And obviously, they're on the surface, so and everyone loves their pets and doesn't want them to die of cancer. And so that's the biggest concern is we see these lumps and we get freaked out. Now, one statistic that should be relatively comforting is that the majority of the skin lumps and bumps that we see on dogs and on cats, but mostly on dogs, are benign. They're not a problem. They may not even be cancerous. They may be cysts. They may be other types of reactive lumps on the skin. So there are certain characteristics that malignant, and cancer, it can be benign, it can be malignant. When it's benign, it just kind of sits in one place and kind of divides, but doesn't divide in a very hugely uncontrollable fashion. But when it's malignant, it divides in a very, very uncontrollable fashion. So that's one key when you're looking at these lumps and bumps is if they're loosely attached, if they don't seem like they're really and cancer means crab. And so in my mind, I think the cancer cells are reaching out like a crab into the tissue. And so oftentimes you'll find these lumps are firmly attached, or they may actually have an irregular shape to them. They might be hot. If you have bare skin in the area where the lump is, you might see inflammation, which could be a sign of cancer, could be a sign of something else like an infection or some kind of inflammatory lesion. So, and then of course these mast cell tumors, they're a big bugaboo for all kinds of pet owners. And the good thing about mast cell tumors is that most of them are not a problem. Most of them don't even come back after you surgically remove them. And if you don't surgically remove them, they don't cause a problem. But the problem is there are some of them which 1/3 of them, and actually not very common, that as compared to the total number of mast cells, that are quite aggressive and can metastasize from the skin to internal organs and cause problems. And so my solution in practice is to do what we call a fine needle aspirate. First of all, just as a way of finding out what is that lump. And I know a lot of people are freaked out a little bit about the idea of biopsies or an aspirate's a form of biopsy, a pretty low-level biopsy, about it possibly spreading the tumor. And the reality is in most cases, that's just not true. But there's a few, and especially if it's in the abdomen. But when it's on the skin, much less of a problem. So I recommend a fine needle aspirate. We take a teeny little needle and we just stick it into gently into the lump, and then we spray what we got out in that tiny little, a needle onto a slide. We dry it and stain it and look at it. And based on the appearance of the cells, we can tell, is this cancer? Is this not cancer? Is this malignant? That sort of thing. We can't really tell the grade of the mast cell tumor, although the aggressiveness of the cells could indicate that. Commonly, if we do see a mast cell tumor, that's a good conversation to have with your veterinarian about the various risks that are involved. I don't think every mast cell needs to be surgically removed. I don't think animals need to go under anesthesia that frequently, but it's not an easy determination with mast cells. But with everything else, it's pretty clear cut. So that's my story on lumps and bumps.
Thank you so much. That was very very informational, educational. And, as you're talking, I'm thinking, it's been a long time since I've been in hands-on vet practice, but I did work at a holistic clinic for a couple of years. Yeah. And the vet that I worked with, and of course we saw tons of lumps and bumps. And, one of the things that I guess her anecdotal experience is that sometimes with mast cells, in some cases, it seemed like removing them almost triggered more mast cells, or at least that seemed to be the her take on it. I've also,
I'm not sure about that. I'm not disagreeing or agreeing with it.
Yeah.
I think that we do see some patients that do seem to be like factories for mast cells.
Yeah.
And maybe it's not the removal, but it's just the fact that
it was going to happen anyway.
I don't know, but mast cells are probably the biggest issue, and it's fortunate, that we have our mushrooms actually, which have beta glucans in them, which help to increase immune system vigilance against things like that. But we also have our mushrooms like the 5 defenders or reishi or chaga, which have terpenes in them that actually help to stabilize mast cell membranes, which would be good if we're dealing with these mast cell lumps, but also good if we deal with allergies. And typically the dogs who have these mast cell tumors oftentimes are allergic dogs, and the mast cells are the allergy cells. So they get all activated, they have to divide and respond to the allergy. And I think that multiple divisions is what maybe sends them into more of a cancerous kind of a state. I don't know.
Yeah.
I thought.
Forgive me, people. I'm recovering from being ill, so trying my best not to cough, but apologies in advance. That's interesting what you said about the mast cells and, like removal possibly waking them up versus they were coming anyway. And it was just more coincidental that the surgery happened and that those mast cells were going to be forming regardless. The other thing,
and it's hard to have an animal be their own control to really know.
Exactly. And I think that's what makes it so confusing with lumps and bumps, because I've also heard, the fine needle aspiration, particularly with mast cells, that it could, quote, make them angry to where, and again, it becomes so challenging because you have a dog with a lump, you want a diagnosis. Then there's also the fear of like creating more problems by kind of messing with it. And I guess it's just a case by case basis. Yeah.
Maybe that the ones that become more angry, so to speak, are the ones that already are a high grade. And we, but because there is that risk with the high grade tumors, I think we need to do something, unless you just don't care and just want to let whatever happens, happens, my own dog, Ollie, he's got a bunch of these little lipomas all along his midline, and I've aspirated them at home. I don't even have a microscope, but I aspirate them and I squirt out what's in it. And it's like this fatty blob. So I know they're all little lipomas.
Yeah. And that must be relieving to have that experience, with Scruffy, with my little dog, Scruffy. I call it her little old lady wart. She's got a little hard lump on the top of her head, and it's been there for a year, and it hasn't, it appeared, I watched it, I was trying to decide what to do, but then it just stopped growing, and it kind of hardened and did nothing. So at this point, I'm just keeping an eye on it. It's kind of impossible to not keep an eye on it, because it's right on the top of her head. So when I pet her, I can feel it, or somebody say, your dog's got something on their head. But given her age and the fact that it's not causing any problems, it's not growing, etc., I've chosen to just leave it the way it is. And of course, she's on lots and lots of mushrooms, 5 defenders, etc. So yeah. Excuse me. So maybe we can start taking some questions. So English Mastiff has several lumps and bumps. Last night we found a new one on his shoulder. This morning we noticed it had broken open and it's been leaking and red tinged fluid all day. Thank you. Ooh. Yeah.
So I said this before, all lumps and bumps that we see are not cancer. There are a number of different dermatological problems which also create these little lumps. And that Mastiff with the lump that emerged and then ruptured, to me, sounds a lot more like an abscess or a sterile abscess. We'll see some dogs that have these reactions to food or other things, kind of an allergic reaction sets up these lumps in their skin. I remember I had some Norwegian elk hounds that just in the family, they all had these lumps. And if you squeeze them or if you aspirate them, there's like this solid pus inside. We were really hard set to find a solution to that. But that doesn't sound to me like it's a cancer, but certainly, you need to ask your vet about that too. Are you muted, Joni?
Sorry about that. Yeah, I was muted because I was coughing. Wouldn't you agree? This sounds like a case where this person should probably take their dog to the vet if this is a leaking shoulder. Maybe they can even get some information from that fluid.
Well, at least to clean it up, to clip the hair around it so it doesn't get all matted, and maybe, put some kind of a dressing on it, maybe give them something topical to put on it. You don't always need oral antibiotics to treat these topical problems, these skin problems. And there's many topicals that can work quite well, including herbal topicals and topicals made from mushrooms.
Yeah. By the way, it's nice to see all the people in the chat. Welcome, everybody. And you know what? Before we go any further with more questions, we need to announce the promo. Cool. Because for those of you that have been following us for a while, every month during the Q&A, we announce a promo, and it's going to go till the end of the month. So until May 31st, Healthy Pup 25 for 25% off site-wide. You can write that down or maybe take a screenshot. We'll pop it up a few times during this Q&A, but this is such a wonderful opportunity to stock up, not just for your pups, but for yourself, because we also get lumps and bumps.
Yeah, and other things on my back.
Yeah, exactly. So let's see. Next question. Yeah, there you go. You've got a. Would you call that a lump or a bump or a lum bump?
I'd call it a papule.
Yeah, there you go. So is there any way to get rid of lumps and bumps without surgery?
Possibly.
This depends on what it is, right?
Possibly, yeah. I mean, certainly if the immune system can be vigilant and take care of it, then yes, that's possible. And and I think that as much as the lumps and bumps disturb our cosmetic aesthetics of how our dog looks, and as they age, we have to get used to them changing in how they look. Really, I don't recommend the removal of lumps unless they are a problem.
Yeah.
And I know it's kind of yucky petting the dog and feeling lumps, but once you've checked it out, once you've aspirated and found out that it is not a risk to the dog, the only reason to remove it is for your own sake, not for the dog's sake.
Unless it's like maybe under the armpit or causing any kind of
it's in a location
to movement or something like that.
Yeah, like fatty tumors, lipomas, we don't recommend the removal, but sometimes we'll get them in the armpit or we'll get them so large on the elbow that they can't even move the elbow. Yeah. Those are times when it's a good idea to remove that.
Yeah, absolutely. Mm-hmm. Britta, let's take one from the chat here. Why don't you choose one? Oh, hey, Kelly. Good to have you on board. Kelly said, I hope I'm pronouncing your name correctly, Sidivi. My dog has a lump sore on ankle hock, and when playing ball, she slid and it was bleeding. I'm getting it checked out, but would any certain mushroom help, along with her being, so she's also itchy? Thinking 5 defenders?
Yeah, I think 5 defenders. I think, personally, I believe mushrooms are good, even when you don't have lumps that get ruptured when you are playing ball. But and we don't know what the lump is, so we don't know how responsive it would be. But I think certainly this may be a wake-up call that it's time to get some immune enhancing agents in there to help your dog. And the itchy part, the five defenders can be good with that, as we mentioned, with the stabilizing of mast cell membranes. Itchy can be caused by a lot of things that gets complicated. But as far as the lump's concerned, I think the mushrooms will be good.
Yeah, absolutely. We hope that it's nothing serious, Kelly. Next question: which mushrooms could reduce a bump that the vet described as something akin to acne? He removed the lump and took one stitch on the top of his head, but now it's back.
Well, acne is, are pustules. These are little, infectious glands that have pus in them. So that's probably why it's back. And I would say probably a mushroom that might help with that type of, infectious kind of a lump could be our five defenders as well, which has five really potent mushrooms in it, including chaga, which I think would be very good for that.
Yeah. Do you think that there might be a also potentially a diet, like look at dietary? Could this potentially be some sort of allergic reaction or food intolerance or something like that?
Those same types of, like I was talking about with the Mastiff and the Norwegians that I had seen in my practice, oftentimes there is a diet connection
Yeah.
to that. And this may be a kind of a different manifestation of a food allergy. With food allergy, we think about goopy ears and, redness between the toes or maybe anal gland issues, but there can be other systems with it, with which we get problems as a result of a reaction to food. So
Yeah.
I would probably start, with a, a food sensitivity test like NutriScan.
Yep. Gene Dodd's NutriScan.
Mhm.
Yeah, like I always learned, kind of there's a gut brain connection. There's also that gut skin connection, and often there could be stuff going on internally, and it's not until it shows up externally as a skin issue. But often treating the enteric system can
Yes.
support the clearing up of skin issues. Another mushroom that I'm hoping we get to talk about tonight, and I know you're going to be writing a blog about it, is tremella. So very excited to hear that you have an upcoming blog about tremella for pets.
Pretty amazing mushroom, and really when we do talk about skin conditions, I think we really need to always include tremella in that conversation, and in part because it has this wonderful hydrating effect on the skin and really helps to improve the overall health of the skin, as well as working on the immune system, that the skin's own immune system, because of the beta glucans in the tremella. So yeah, it does have a lot of applications. Maybe adding the tremella to a five defenders in an allergic animal could very well be helpful in terms of supporting the skin. Of course, there's other things we'd want to use for skin, especially fish oil, flaxseed meal are two things that I highly recommend be given daily for every animal, regardless of whether they have skin problems or not, but can be especially helpful for skin problems.
Yeah. I'm curious about like dogs and cats with dry skin, whether tremella would be, because of its ability to, kind of draw moisture.
Here in Colorado, I mean, those are the kind of skin problems I see. Is dry. It is dry here. Alligator skin dry. So so tremella is a godsend in that regards. As well as keeping them hydrated and feeding them fresh foods. The dry foods, the kibble, really dry them out a lot. Even the canned food, but fresh, wholesome food that's 70% water really is the way to go when it comes to keeping the skin healthy and hydrated.
Yeah, and I would say if anyone decides to give tremella to your dog, make sure you try some yourself. And in about a month, you won't be able to stop touching your face because your skin will feel so. It's like it's the mushroom that I noticed the most like physical difference with, because you can really feel the difference. Or at least I can. That's my little.
I put it in my smoothie.
Do you put it in your smoothie?
And the nice thing about tremella when it comes to pets is it is uber bland. So even a cat will take the powder. I can't speak for all cats, but even most cats will take it, blended in with their food. And tremella, lion's mane, cordyceps, I think are the top three when it comes to palatability.
As far as palatability.
Mhm.
Yeah, and Britta, when you get a moment, I know you've got a lot going on back there. Maybe you want to drop a tremella link in the chat because it's a mushroom that I think a lot of pet parents that it's one of the newer mushrooms. It's been in the Real Mushrooms repertoire for a number of years, but it's not in any of our pet products, but we do have it in capsule and powder form in our large or human size. Yeah. So next question from Janie Elliott. Are there any mushroom supplements that are good for cats? I have one with a mysterious allergy that is causing him to pull out chunks of hair. Ugh.
Well, yeah, I think first of all, the mushroom that a cat will take is the best mushroom for them. And as I had mentioned, the tremella, the cordyceps, and the lion's mane could be very good for a cat.
And functional feline.
Functional feline actually has 7 mushrooms in it, along with active probiotic cultures and detoxicants and adaptogens. So there are many that would be good. The mysterious allergy that's causing him to pull out chunks of hair, I would look to the food. I think that with a cat, that's oftentimes a food allergy. And there is another product that's not a mushroom that we've been recommending for cats with allergies, which is called PEA. It's related to CBD and got a long name. That's why we abbreviate. It's palmitoyl ethanolamide. It's very bland tasting and may take a month or so to build up in the system, but that also can be worthwhile. But I'd look at the food first, and maybe you could check to see if you have in the last month or so changed the food, or maybe the company itself changed the food on you, even if you're feeding the same brand.
Yeah. And while we're on the subject of cats, I did want to give a shout out for Functional Feline because oh my gosh, it's such a great formula. It's our newest product. Oh, I'm glad you have it there because I don't have it on my desk. It's our newest product, and amazingly, it's something that most cats will actually eat. I think there's a lot of reluctance to try a cat product because cats are so finicky. And I'm happy to say that, well, you and Britta, I couldn't make it because of my illness. We're at the Dr. Judy Naturally Healthy Pet Experience 2 weeks ago, and we're handing out small samples of the Functional Feline. So can't wait to hear feedback from people that have tried it. But yeah, I can't encourage it strongly enough. This Functional Feline, which is kind of the feline version of the Daily Dog, which, by the way, we're hoping to get back in very soon. We've been out of stock on it for a little bit, but we are waiting for it to arrive in our warehouse any day now. So hopefully very soon. So yeah. Oh, and I also, before we move on to the next question, I did see somebody was asking, Melissa was trying to apply the code to the auto ship and it didn't work. Melissa, if you're talking about a subscription, the code wouldn't work for that because this is a one-time 25%, and we can't apply a code to something that's going to ship monthly. Yeah. So sorry about that. The code only applies to like going on and placing a one-time purchase.
And there was also a question about getting real mushrooms in Canada.
Oh yes, so. You can now buy real mushrooms in Canada, not the pet products, but you should be able to go on our website in Canada and order real mushrooms products. Just not yet the pet line, but what we call the human products are the same mushrooms that are in the pet products. There's no difference. It's just the size of the capsules, right, Rob? Yeah,
this is true. Yeah, and the hang up with Canada is Health Canada. That's the Canadian FDA, and they're actually more stringent than the U.S. FDA. And some of the proof that they're asking for us just doesn't exist. So I don't know. I hope we can get that past them. Yeah,
we're working on it. We're working on it with the pet products, but for now, we are. Yeah,
absolutely.
Yeah, exactly. Alrighty, excuse me. Next question. What should be done for deeply embedded ticks, and what are the best preventative measures? Can you recommend a safe and effective supplement to repel fleas, ticks, and heartworm?
Okay. Well, I think you need to get a hemostat and pull it out as gently as you can. If it's not something that you can do without causing damage to the skin, then I think you need to ask your vet to help you with it. The best preventative measure for ticks that doesn't involve a supplement or doesn't involve a product is simply every day when your dog comes in, to go over them with a fine-tooth comb, literally, or just with your hands to try to find the embedded ticks. The ticks like to be on bushes, and when the dog walks past the bushes, they jump onto the dog, and so oftentimes you'll see them, around the ears or armpits or, a groin area are common areas to find them. In terms of safe and effective supplements to repel ticks, fleas, and heartworm, I can't really recommend a natural supplement for heartworm. I'm just not certain that any of them have been proven to be effective enough, at least to my satisfaction. And heartworm is such a nasty disease, and I think that the drug that we use for it has shown itself over years to be relatively safe for most animals. There's a few that it's not that safe for, and you'll learn, from its reaction to it. As far as repelling fleas and ticks, the use of essential oils can be very helpful. Things like citronella, tea tree oil. There's some companies that actually manufacture collars and sprays and things like that to help repel ticks. I've even seen little things that can go on the collar that have some kind of
tickless collars, yeah. Yeah,
let's I hope it works, and then there's things like diatomaceous, and there's the difference between fleas and ticks is fleas spend most of their time off the animal. Most of the time they're in the environment. And so, so really it's really different things that we would use for repelling the ticks and repelling the fleas. For the fleas, we want to use things like diatomaceous earth, which can be dusted on the animal, but also, most importantly, we need to be aware that the fleas breed and live mostly in the environment and then jump back onto the animal to feed. So we have to take care of the environment as well. And there are natural approaches to that. I don't, off the top of my head, know to recommend that. Colorado's, I was whining about the dryness here, but the other side of that coin is that I've almost never treated fleas. We do treat ticks here, but I've never treated fleas. So I'm probably not the best person to ask. And mushrooms can help improve immune system function, and we know that oftentimes they can help with fleas and ticks, but they're not going to be as good as some of these essential oil based or diatomaceous earth based types of approaches.
And if I can weigh in, I'm gonna get up on my soapbox a little bit here, because this is a topic that's very passionate for me for many reasons.
Sure.
First of all, in answer to where it would be a good place to find out this info, Rodney Habib and Karen Becker on their Inside Scoop, their subscription Facebook page. It's like a month or so ago, maybe more. They did a flea and tick overview, and they had veterinarians from the East Coast, from all different parts of the United States, weigh in on the best flea and tick preventatives for that area. And I think that's really important because right now I'm in Berkeley, California, in the city, and I'm not using any flea and tick prevention for my dog Scruffy. But this time last year I was in Buckingham, Virginia, which the ticks were so bad that I tried everything. I did the tickless collar, I did the Wonder Side, I did all the natural treatments, and Scruffy she has an allergy to ticks. So she ended up the year before, she had ended up in the ER twice, reacting to she got into a seed tick, a nest of baby ticks, and I nearly lost her. So last year, when the ticks started up again and it was really bad, and I tried everything, I finally broke down, and I used a pharmaceutical, I used a veterinary prescribed tick medicine, because I decided that the risk of that was even though it was a risk, that it was less than letting my dog get bit again and end up in the ER. Then I ended up contracting a tick allergy called alpha-gal. I've now moved back to California. It's an allergy from a tick to anything from a mammal. So fleas and ticks, well, fleas, that's another story, but ticks are not something to be taken lightly by any means for your pet and also for yourself. Like you really want to make sure you're combing, and depending on what area of the country you're living in, treat accordingly. And I have a problem, I think in our holistic pet health care community, there's such a fear of using some of these non-natural therapies that often people get shamed when they say that they are using them. But, it's individual. It's like, that's why I'm speaking up about it. It's like, yeah, I'd love to be able to say I've been all natural, like my dog's she's never taken any other meds, but in this case, I made the choice. So I do think it's an individual choice, and it's depends on what part of the country you're in. So yeah, Rodney and Karen, inside scoop. I'm going to stop talking now.
Okay. So just to reinforce what Joni said, and and that was excellent advice, Joni, but not worth losing your lungs for that. As a veterinarian, I'm not quite as nervous about using pharmaceuticals and things like that. And so this spring, when Ollie started picking up some ticks, because we have a fairly narrow tick season, I gave him 1 dose of Frontline, a spot-on drop, and I don't, all these new modern drugs, I don't really trust them. NexGard and whatnot, I just don't know what's going on with them. But Frontline is just straight Frontline is something I've used for years, and never seen any problems with any of my patients or any of my own critters. And Ollie's got much bigger problems than and I don't have as much time to be plying him with all the diatomaceous earth and all the other things that we would need to do to protect him from those. But and so yes, I'm a little nervous about revealing that and being shamed for it, because I'm sure there will be some people out there that go, see, Silveries, whatever, But as a veterinarian and as a holistic veterinarian, I believe that the most important thing to use is what works with the least amount of harm and does the job as quickly as it needs to be done. That means the use of pharmaceuticals when appropriate and appropriately dosed.
Yeah, first, do no harm. And, sometimes that means taking a path that you wouldn't normally take. And I did want to add another resource. I noticed, maybe it was yesterday or the day before, Rachel Frisaro, who is a wonderful pet advocate and influencer. If you follow her Instagram, I know that she also took a deep dive into flea and tick medications, and came up with, working with a veterinarian, came up with kind of the least bad ones should you have to, choose the pharmaceutical route. So I would encourage you to also take a look at her page and see if, if what she's saying resonates. I was actually thrilled to see that, because I love seeing other people in our space saying, like, nothing is black or white. There is gray, and we have to, like, Kimberly Gautier, she's keep the tail wagging. She also often says, you work with the dog in front of you. And so each of us makes our own choice based on our most, it's great, get educated, listen to the people, listen to the experts, and then make the best choice for your pet and for your comfort level too. So, yeah.
Well, that was a good question.
Yeah. Okay, let's move on. Very large lipoma, lower left abdomen. Ideal weight, 65 pounds, now 85 and intentionally reducing. What's the best mushroom to help detox and reduce this lipoma? Turkey tail, and how much or how often?
Well, I think getting the weight off will be a good thing to do. And and I've not had great success with anything to reduce lipomas, but I keep hearing people telling me, anecdotally at least, that they're getting success in their dogs using turkey tail for the lipoma. So I think, I'll just say, yep, I think turkey tail is probably a good choice there. And because turkey tail does also have some benefit to the liver, you certainly could, look at that as also part of a detox for that. Or you could add the daily dog when it comes around, because we've got some detox in there. Or you could add another mushroom such as reishi, which would be another good detox mushroom to do. Now, at ideal weight 65, but we're going to treat the dog in front of us, that's 85. I would recommend, if you're using the turkey tail powder, then I would recommend about 3/4 to a teaspoon twice daily. But I would start with just a 1/4 teaspoon. And I would start with a 1/4 teaspoon every week. I would escalate it by a 1/4 teaspoon until you reach that optimal dosage, or until your dog says, I don't think I like the taste of this powder anymore, in which case you may have to find something more palatable to mix it in, to blend it in, to get it to him, or go to the capsules. And with the capsules, each capsule is a 1/4 teaspoon. So that makes it easy in terms of what I'm saying. 1/4 teaspoon or capsule, same thing. Start with that twice daily. Every week, increase it by 1. And let us know how it works. I'm gathering information. I don't know everything. That's for darn sure. So I learned. I'm humble. I learned so much from my clients. From the pet parents, and because they're right there. They're in the trenches with their critters. They're the ones who are
Absolutely.
best able to understand what's going on. Even if they can't describe it in medical terms, they still can observe it.
Exactly. And, we get this question so much, the lipoma, what to do, and is turkey tail going to help? And I think many, many times over the course of these Q&As, we've kind of came back saying, we've heard it's helpful. We haven't, I don't think either of us have seen evidence. Like we've asked before, like anyone out there that tries it, like we'd love to see a before and after, like actual, like, show us what it looked like before, show us what it looked like after the turkey tail. Because people are saying it's helpful. Also, I know Rita Hogan's done a beautiful write-up on lipomas and the use of turkey tail as well. But I'd love to think that it works. Absolutely. Yeah.
Yep.
The next question. There's a possibility my senior dog could have a tumor under his tooth that wanted to do a total mouth extraction. I don't want to do this to him at 13 years old. Should I start him on turkey tail? That's a tough one.
I can't really tell you what to do. If your vet wants to do a total mouth extraction, or maybe just an extraction under the tooth, he must have good evidence for that. I would hope he does. And realize that if it is a tumor that is malignant and you don't do anything with it, and the use of turkey tail or other mushrooms aren't effective, then that will, continue to progress. So I think turkey tail is a good place to start. We don't really know what the nature of the tumor is, so we can't really specifically suggest a mushroom that might be better for one type of tumor or another. So yeah, I think turkey tail is a good idea. And, look at giving him the same kind of dosage that I just was recommending there. I don't have a weight here, but if you look at, a 1/4 teaspoon for every 20 pounds of body weight, twice daily, I think that's a good place to start. And then you can try to increase that, because where that tumor is, you're going to need a pretty high amount of a mushroom to get to it.
Sorry about the muting. We hope it makes a difference.
We do.
Or that you get some, you come to a decision on what you're going to do here. Yeah. Next question of Kelly again. Just found out by ultrasound yesterday, my senior 10.5-year-old has an undefined liver tumor. He's getting a CT scan next week for more info, but his ALP has jumped. I do have your products. I want to start increasing dosage, Best results for cancer, 5 defenders, ERGO, daily Dawg, or singles like Reishi, turkey tail, or do them all. Increase more than daily dosage. How much?
Yeah, I'd go singles, and I'd combine reishi and turkey tail, both as capsules or as powders. You're probably going to find them both a tad bit difficult, to take in terms of palatability. So looking at the capsules is a better way to go. And I think what I've just recommended, if you've been listening to dosing, I think would fit for these. These are fairly severe problems, and so I'm recommending fairly high dosages in order to get some better response. So so quarter, a capsule or a quarter teaspoon per 20 pounds of body weight twice daily, and then you can escalate that weekly. And once you get the ultrasound, that may change what
Yeah.
we're doing. So you may want to wait to get too aggressive with it till you get that information back.
Right. If she was willing to add another one, what do you think about ERGO? Would that be?
I don't have any reason to recommend ERGO for a liver
Okay.
it has a lot of value for many things, but I don't know that it specifically is going to help in that situation.
Okay.
And there's only so much you can give. There's only so much your budget can handle. So, I try to keep things fairly simple.
Yeah. And there's probably other things in addition to mushrooms you're going to be looking at as well. So,
Chinese herbs, the whole thing.
Yep.
Yeah.
Yep, absolutely. Best of luck with that, Kelly.
Mm-hmm.
Next question, should you give your dog a break from mushrooms, feed on a rotation, or is it best to continually feed?
Well, there's no reason to break or do a rotation, but you can if you want to. I break on the weekends. I just get tired of doing it. Take pills all the time for me, give it to my pets all the time. I like to have a break on the weekend. And if you're not working with a critical problem, you could very well rotate from one mushroom to another or one combination product to another, simply to expose the body to different active ingredients. And again, I don't know the specifics of this, but that would be a reason to rotate. To expose them to different elements.
And as far as taking a break, I don't know, kind of throwing this out of left field, Rob, but I know you love these random left field questions. What about, I know you've talked before about the concept of trained immunity, trained innate immunity, and how that ties in with the, taking mushrooms regularly. It's like it trains the immune system. So if you miss, if you miss a day or two or
there's no problem there. No. Once you've got them on the mushrooms regularly, let's say you've been doing it pretty good for a month, maybe just weekdays, but still for a month, that's enough time, I think, to build up this, what we call this trained immunity, which is an interesting concept, that the mushrooms somehow have an influence on the immune system to help the immune system work better in terms of remembering pathogens that it had looked at prior and being able to respond to those pathogens much more quickly the second time it sees them. Something that we don't normally expect from one part of the immune system, which is the part of the immune system the mushrooms usually affect, versus the other part of the immune system, which is the part which is called the acquired immune system, as compared to the innate immune system. The acquired immune system is what what has a specific has vigilance against specific types of pathogens or antigens, or toxins. So you can, once you have the mushrooms on board, there's no harm in taking a break for a week. And if things screw up and for some reason you run out of mushrooms for a week, I wouldn't panic. I think you'll be okay as long as you can get them back on it again.
Yeah, that was when I first kind of learned about this concept. The first thing I thought of was that kind of non-compliant pet parent. You can't always. I don't remember sometimes I'm busy and it's all I can do to get the food down for my dog. The whole routine, the whole supplement routine can take a lot of time in some cases, and so it brought me great relief realizing that with mushrooms, it's almost like the immune system remembers, and so that missing is not as detrimental as we might think. Yeah, awesome.
So don't sweat it.
Yeah. That's a great question. What's the number one preventative way to keep cancer at a distance?
Well, it's known that most of the causes for cancer are not genetics, but in fact are lifestyle,
Yep.
from diet, from environmental causes. So, and also emotional. And so, I think that would be the first place I would look at is, feeding a wholesome diet, fresh food full of antioxidants with a nutrient profile that doesn't promote inflammation, which is a driver for cancer. Fresh air, exercise, environmental enrichment. I think these are all very positive things, and I think should really go into the mix first. And then, I think mushrooms and immune enhancing herbs can getting going away from the mushrooms and immune enhancing herbs. Before that, we want to be able to support the microbiome as well, and microbiome being, as we understand it now, kind of the seat of all health. And so that involves also, the food that you're feeding, because healthy food creates a healthy microbiome, but it also involves, supplementing with appropriate probiotic cultures or fermented vegetables. Different types of fermented foods can provide a wide array of probiotics that can be very beneficial for the bowel, probably better than the probiotics in a little capsule as well, because they're very focused, and you want to have a broader spectrum probiotics. And then looking at mushrooms and immune enhancing herbs, I think would be the next thing to do. But we'd all like to know what that secret sauce is to keep cancer away from our doorstep, because it seems as though, it's out there, Again,
Sorry about that.
It's okay. I like telling you, because you're always telling me that I'm on mute. So now
I know, and I just don't want y'all to have to be listening to me coughing. By the way, I feel great. It's just leftover lung stuff. But the environmental stuff, oh my gosh, it's getting harder and harder. You can eat such a clean diet. You can, do all the right things, and just the very nature of the environment. We take our dogs out for a walk, and they're sniffing a lawn that could have been sprayed with, with a weed killer or glyphosate or, any of these things, pesticides.
Yeah.
So it's, we just have to do our best, but taking mushrooms, but for sure, I mean, there was that study, human study, very large study about how mushrooms kind of preventative, like for all cause mortality, basically, mushrooms help you live longer. There's a clinical study, that says that.
Yeah. So, and definitely. I just read a paper today or yesterday about incidence of cancer in dogs, and how they did analysis. And they found that most of the dogs that had cancer also had levels of glyphosate and 2,4-D, two herbicides right there. So, I mean, and then they talk about how dogs are much closer to the ground. They're sniffing, they're licking their paws, they're rolling in it. They're much more exposed to it than we are. But in many ways, they're sentinels for human health as well. And we should be aware of what things are risk factors for our dogs, because they're risk factors for us too,
Yeah, they're literally the canaries in the coal mine, the canine and feline versions.
Yeah, they actually used that phrase in this paper too.
How did they?
Yeah, sentinels for human health, canaries.
I want to announce. I said I'd announce it a few times during this event. We run a special for anybody that's listening or listens in on the. This is posted on the YouTube channel after this finishes up. But Healthy Pup 25 for 25% off site-wide on our Real Mushroom site. This is not just for pet products, but for all of our products are human products as well until May 31st. So go ahead and take a screenshot or write it down and utilize this 25% off discount. Alrighty, next question. If a lump keeps growing, is there a point where it becomes uncomfortable for my dog? He has a large lipoma on his side.
I mean, I've taken some off that literally were 10 pounds. So it depends on the location. But yeah, when it gets that big, that could be a reason to remove it. It's a difficult removal because as it grows, it stretches the skin out. So then you're left. You have to excise all the skin to get it to go back together, and there's all this dead space. It has to. It's not an easy surgery. Although the lipomas themselves come out real easy. I don't know if you want to hear this or not, but once you make the incision over it, it's almost like a jellyfish in there underneath the skin. You can almost go with. Oftentimes I would go with my glove, and I could just dissect it out with my glove and pull it out just like this. They're really
And it's just a big fatty lump, basically.
big jellyfish. It's a big jellyfish under the skin is what it is. But yeah, most of them come out pretty easily and most of them don't come back, but some do.
Yeah. And I think, yeah, like you said, Doc Rob, it really depends on where it is. It could be, just thinking about it from, when I was, I used to work in canine rehabilitation, and you'd have some of these dogs come in and they'd have these huge lumps that have been hanging off their sides for years. And, they're structurally, I mean, can you imagine like carrying a bag around, structurally would throw you off and create, the body has to compensate. So depending on how much it weighs, or again, where it is, if it's under the armpit rubbing or somewhere that they can't lay down comfortably or something like that, it could be uncomfortable for sure.
And there is a malignant form of lipoma. It's called liposarcoma. And they're nasty because instead of being a nicely encapsulated jellyfish that's easy to get out, like I was mentioning earlier, like a cancer, it's like it's the tendrils of this fat go in between muscle planes. That's really a mess to remove. And so that's why it's a good idea to be aware of them and to show them to your vet when you get in there and get their opinion as far as whether they think it's something that absolutely needs to be removed.
Yeah, I've also heard the argument in some of our pet communities that a lipoma is something you want to remove because it's like lipomas kind of surround something toxic. I don't know if there's any science behind that or anything like that. Yeah, this is something that I've recently heard discussed, that lipomas aren't necessarily benign because they actually create themselves to protect the body from something toxic.
I think that lipomas in part result from the lipid peroxidation. This is the oxidation of fatty material in the food, which ultimately gets incorporated into the fatty tissue in the body, and that this contamination of the food is also carcinogenic in nature, and that's why we see that. And we do see it more in certain dogs than others. Labradors, for instance, I think are quite common, and as a breed, they tend to have an extra layer of fat to protect them against that cold water when they're jumping into the cold, cold lakes or cold ocean.
Interesting. Yeah, it's lumps and bumps. They're kind of fascinating. I mean, they're scary and they're also fascinating, and they could be so many different things. And so what is our next lumpy question, Britta? My dog was diagnosed with a localized histiocytic sarcoma of the skin in August. I've been giving him 5 defenders since September, but a new growth came back. Do you have any success stories with histiocytic sarcoma?
Well, I don't have any failure stories either. I think it's so individual, and maybe this is a Bernese mountain dog that oftentimes gets these. It's commonly we see these in that breed. There is a genetic tendency to that. I would give him more. I mean, I don't know how much you're giving, but I would definitely look at the amount you're giving in order to have better results. And the 5 defenders is good to use because it's got so many, 5 different mushrooms in it, but you'll have to, up that dosage to make sure. And it would be weight based. And I would look at my same, quarter teaspoon or 1 capsule per 20 pounds of body weight twice daily, and I would try to escalate that to the point that your dog to when your dog won't accept it, or to when your budget gets too high or it exceeds. I don't know what the weight is, but exceeds maybe a teaspoon twice daily.
Do you think, Doc Rob, that there's any benefit to switching to maybe a different mushroom like turkey tail or a turkey tail reishi combo if the five defenders?
This is maybe where the rotation concept comes in. That yeah, maybe it's time to try something different. Of course, we've got the turkey tail, we've got the reishi, and the five defenders, so we're not really getting that much more by adding that. We could look at adding something like cordyceps, or lion's mane or tremella, for being something different. It's hard for me to say because we don't really have that much published evidence and that much anecdotal evidence. We're having that fungi forum this coming next week, which is for veterinarians, and one of the purposes of this meeting, where we're going to have maybe 20 or 30, hopefully maybe even more vets talking, is I've asked them to bring cases, and we want to discuss what are their successes, what are your success with these types of problems, because that's the best way for us to really develop understanding of how best to use mushrooms clinically.
Yeah. This is how we learn and how we're able to share with you. And by the way, we have 225 signups. So I know, isn't that wonderful? This is like veterinarians and practitioners who are interested in, learning how to help your pets. Melissa's actually given feedback on this. She says that this dog with the histiocytic sarcoma is a golden retriever. She's giving him 3 capsules a day. He's doing well enough. And I'm thinking, Melissa, that this is your question here. Mm-hmm. I could be wrong. But it kind of popped up as you were talking, Doc Rob. So,
well, if this is your golden retriever, let's say he's like 75 pounds, maybe 85, I would double that at least, and maybe go with 4 capsules twice daily.
Yeah.
If he'll accept it. Mm-hmm.
Yeah. Good idea. Our next, and it was Melissa says, yes, it is. So hope you got that feedback from Doc Rob. We wish you all luck. And this may be our last question. We'll see. I have a 7-year-old female vizsla who is diagnosed with mast cell tumor. She has 2 removed and more. We are on Cleo's protocol. I noticed she now has 3 wart-like bumps. Is it possible these are mast cell tumors?
Well, mast cell tumors are generally smooth. Warts are kind of, look a little bit like cauliflower or something. Verrucous, we call that term. I don't know what Cleo's protocol is, though. I'm curious about that. Always curious about all these things, that people are using, the fenbendazole and the ivermectins and all these.
Yeah, I've heard of Cleo's protocol, but I wouldn't be able to
I'll look it up.
List it. It's a protocol that's out there in some of the pet groups. Yeah.
Yeah, I'll make a note. Look it up. Sounds interesting.
Yeah. But yeah, my experience is warts look very different than mast cell tumors.
They tend to.
Yeah. I'm going to hop in here because Troy just popped in with a really good question. Can we give them as a preventative? I'm thinking he's asking mushrooms. Can we give them as a preventative so they don't get anything? I think that's a great question because I think that's the best way to work with mushrooms is as a preventative. Would you agree, Doc Rob?
Well, I think because they help to improve immune system vigilance against the little mutations that create the cancer cells or other infectious agents that might also stimulate cancer. Yeah, I think it's good. We kind of answered this already regarding can it prevent cancer?
Anything. I mean, not just cancer, but kind of. I like to call mushrooms like health insurance.
Yeah, but certainly, I think they could be a very good preventative for many things. I wouldn't want to bet the farm on it, though. I mean, there's animals have a wide variety of responses to things, a wide variety of different strengths of immune system, a wide variety of challenges that address them, and so I mean that's pretty general. So they don't get anything. And I'm just
we can't. Of course, there's no guarantees, but I guess I was saying after.
I think thinking of mushrooms as preventatives is a good idea. Because it does strengthen the body in many ways. Will it stop them from actually getting stuff? I hope so.
Yeah. I think, because I see a shift. I think when I first got into like mushrooms for pets, a lot of the mushroom use was to, when something had gone wrong, what mushroom do you use? And now I'm seeing more and more people are starting their pets out young on on a product like Daily Dog or Five Defenders as a daily kind of insurance policy. And that's being more accepted. And I think that's a really good way to go, given the feedback that we're getting, at least on the human side, about the benefit of daily mushroom use.
Yeah, and so yeah, I did want to speak up, Troy. It's also good for you too. One for me, one for the dog, one for
That's
me,
right.
the dog.
That's right. And believe it or not, we're out of time. That
Oh,
went by really fast.
it did.
And again, for those that didn't catch it the first two times, for anyone that's listening live or happens to catch this on Facebook or YouTube, if you go to our website, realmushrooms.com, and place an order when you're checking out, it'll ask if you have a code. If you put in HealthyPup25, you can get 25% off your entire order site-wide until May 31st. So by all means, take a picture, take a screenshot of this or write it down. It's a great, 25% off is a great opportunity. And for those of you out there that are waiting on Daily Dog, fingers crossed that we actually get it in before May 31st. I think we will. And you can go ahead and use that 25% off to buy that and try out our functional feline as well. Any last words, our fearless leader, Doc Rob?
Well, I just wanted to say that I'm continuing with my live Q&A events a week after this one. So for anyone who felt that they needed to get questions answered, I will be back on for my own website, Well Pet Dispensary. And if you're not familiar with that, you can go to that website on the landing page and you can sign up right there.
Yeah. In fact, Britta, if you can, if you're able to drop that link for Doc Rob's Well Pet Dispensary, I think you can go to the website and click to sign up to get on the mailing list, which will then.
Well, but actually, we have a direct link, a direct button that you can click that just registers you and gives you.
Fabulous!
Yeah, it makes it quicker.
That's even
I'll
better.
answer questions on mushrooms, but I'll also answer questions about CBD or anything else.
Yeah,
but
highly recommend it. Yeah. So this is 2 opportunities a month to ask questions directly to Doc Rob. So encourage you to
bring it on.
And remember, Doc Rob, the one who wrote the book, There's a Mushroom for That.
Who wrote that book?
If anyone's been under a rock and hasn't seen the book or heard about the book, I encourage you to go on Amazon or go to our website or go to Rob's Well Pet Dispensary where the book is available. And we're getting such amazing feedback. Everybody's raving about your book.
They are. I'm amazed. I'm happy. I didn't know. You write something, you hope, you throw it out there, you hope it's gonna stick on the wall.
Yeah.
So to speak.
Well, it's stuck. Stuck like glue.
Stuck like glue, but doesn't stink.
There you go. All righty, y'all. Well, we will see you next month. Hopefully, I won't be coughing up a lung next month. And we look forward to our next visit with you.
Absolutely. Take care. Be healthy.
Bye. Thank you, Britta, for your work behind the scenes.
Thank you, Britta, so much.
Yeah.